what happened. Cabinet had a discussion about allowances for interns and SHOs. And they made a resolution that they will continue paying allowances for interns and senior house officers, and they tasked the Minister of Finance to look for this money and ensure that interns are deployed and paid, and the government, so that the government can also continue paying allowances for SHOs. During the budget speech, the Minister of Finance told us that he had provided 22 billion to pay arrears for interns and SHOs, and this money ended in June of this year. However, starting from July onward, there is no money available to ensure that these people are paid. The information you are getting from Minister of Health said that we have 8 billion for interns and 2 billion for senior house officers, the money which is not enough for the continued pay. We met with the Minister of Finance, and he gave us a week to answer our questions because we are trying to follow up on his statements he made during the budget speech. And we wanted to know how far they have gone as a government to ensure that the interns are deployed. The week passed and we are not getting any response. The Minister, the Honorable Prime Minister, was tasked on the floor of Parliament to provide answers why the interns are still at home and not deployed. We requested for 2 weeks. The 2 weeks passed and the Prime Minister has not provided any answers up to today. And the interns continue to stay at home up to now. The supervisors, all the specialists who supervise the medical interns, have been having an ongoing industrial action, as we all know. However, we have been able to have some engagements with the head of public service and the Secretary of Cabinet, who gave them due consideration and directed the Ministry of Public Service to do a job evaluation and allocate a new salary which is befitting their qualifications and their job description. We thank her for this. However, the head of public service and Secretary of Cabinet, after providing information that the Cabinet has already made their stand on the issues of interns and SHOs, she directed the Ministry of Health on the 8th of June 2023 immediately deploy interns as they wait the Ministry of Finance to look for funds to pay their allowances for SHOs. However, as we speak today, interns have not been deployed. What is happening in the field or in the hospitals where our patients are going today? The members of UMA, the doctors who are working on patients in most of the regional referral hospitals, are calling us every day. The work is too much, they are overwhelmed, they have tried to look for volunteers to help them to handle the situations, they are also not getting volunteers. We find a single doctor doing the work which is supposed to be made, which is supposed to be covered by more than actually 5 doctors. They are trying to work more shifts than they should to see that they can provide services to all the patients who are coming to hospital, but they cannot handle still. Many Ugandans who cannot afford private facilities, they come to hospitals and wait for the whole day. They don't see doctors, they don't get health care, they go back home. They come back the following day and still wait in lines, and some of them still don't receive these services. The number of patients, mothers and children who are dying in these government facilities is increasing every day. This is happening. Our colleagues know about it. We are talking about it, and the government is giving us a deaf ear. No one wants to talk about it, and yet it is the reality we are facing today. So this is a very big danger, because we all know that healthcare is a right to all Ugandans. And much as it is a right, it also has to be effective and quality healthcare. But the public is no longer getting this kind of healthcare from our colleagues. When you are overworked, you work 2 shifts, you work 24 hours, time comes and you cannot give enough time to the patient to understand their problems properly, for you to be able to make a proper diagnosis and even give them the proper treatment they need for the diseases they have. some of them come, but because you are tired and overwhelmed, you are at a risk of even making wrong diagnosis, make a diagnosis, provide treatment, and later on when you try to reflect on what you did, you realize that actually you make some wrong diagnosis, and the patients are going to let it. It is a big problem, and our colleagues feel they are tired, and they are telling us we need to press on and ensure that government sends the interns to these government hospitals so that they can give us the support we need. Our hospitals are understaffed. When you look at the stand of today, government hospitals, the staffing levels are at around 40 to 45% coverage. The rest of the gap, the human resource gap which is in these hospitals, also the regional referral hospitals, are being covered by the interns who are not there today. And this is posing a very big problem. Mothers, children, accident victims. The numbers of people who are dying because of are dying in these hospitals is going high, mainly because of the gap in the human resource structure we are having in these hospitals. When you go to our villages and many different regions in this country, almost 70%, actually more than 70% of the people in the public, they get health care from government facilities because they don't have money, they cannot afford the private health facilities because they're expensive. So as a government, have we really given enough priority to Ugandans? Because when we look at these people as interns, those people who need to do internship. But are we thinking about the Ugandans who are suffering because of the crisis we have today? Are we giving due consideration as a government to ensure that health services continue in the public? Are we giving due consideration to ensure that we don't lose more mothers who are in labor? Are we giving due consideration to ensure that we don't lose more children and more people and more accident victims who are dying now because we don't have enough human resource coverage in the government hospital? Our colleagues are overwhelmed. The work is too much. The public has started to complain because they're not receiving the care they need. We had a meeting with the Uganda Medical Association in June 2023. We had a very lengthy discussion about this issue. Why we have been trying to government deploy interns and they are not deploying them. Why the delay? Why would Parliament make a resolution that interns should be paid? Cabinet has goes on to have a discussion and resolve that they should be paid. And at the end of the day, we don't see interns being deployed. So we came up with a number of recommendations. And one of them is to request Ministry of Finance to act on their promise and provide funds for the deployment and payment of allowances of medical interns and senior officers as directed by Cabinet before 1st August 2023. We request Ministry of Public Service officials to follow the timeline which were provided by Head of Public Service and Secretary of Cabinet, do job evaluation with the supervisors of interns for the medical officer special grade, and ensure that they change their title and work on the salary discrepancies within the timelines which were provided, which is 60 days. Way forward, as a medical fraternity, in a meeting we held on 10th of June 2023, we resolved that if this non-deployment of medical interns continue as what we are having today, we have no other choice because we have done enough engagements and nothing is yielding. And today we are informing government that if by 1st August 2023 interns are 2023 the medical interns are not deployed, the whole ethics, all of us in the health sector, not only the senior officers who have been on the strike and the specialists, but everyone within the health sector is going to put down their tools until government deploys the medical interns, and then we shall be able to go back and work. Because the work is too much, we cannot just look on seeing ourselves with patients every day and becoming inefficient. It's at every day. Thank you so much.